welcome to our show Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Made up of the glands that produce hormones, the endocrine system regulates almost everything that happens in the body, controlling growth, puberty, processing food and water, and maintaining the proper levels of blood sugar. The pituitary gland is the master gland controlling all the hormones in the body. If the gland goes wrong, then people can suffer with a range of symptoms and conditions. These are rare and can be tricky to diagnose, so more awareness is needed to promote quicker diagnosis and better care. Pituitary diseases are rare conditions with severe chronic multi-organ and multi-systemic morbidity requiring complex multidisciplinary treatment and usually lifelong drug treatment. We have with us eminent endocrinologists to provide medically accurate advice on preventing various endocrine conditions related to the pituitary gland and help viewers identify long-term control strategies. We're joined by Dr. and Professor Dutta, Chairman, Department of Endocrinology, Asira Super Speciality Clinics, and Dr. Pankaj Jain, Consultant Endocrinologist, Pratham Endocrine Clinic, Gwalior. Thank you so much, doctors, for joining us on the program. Dr. Dutta, first to you. Numerous glands throughout the body produce hormones. What are hormones and why are they essential for the proper functioning of the body?
Hormones are chemical messengers which are made by glands. They are released in the blood circulation and they go all over the body carrying vital information. It tells all the different body parts how much to work, when to work. So there are hormones for sleep, there are hormones for appetite, there are hormones for energy, there are hormones to control the metabolism. So they are like the language by which different body parts talk with each other.
Right. Well, that's an explanation on, what the hormones do. Dr. Jain, the endocrine system is responsible for regulating a range of bodily functions through the release of the hormones. How does the endocrine system work, and why is the pituitary gland called the master gland?
Endocrine system continuously monitor the amount of hormones in your blood, and they deliver their message by locking into the cells, and they target where they can relay the message. And this is called the master gland because there are many hormones is produced by the pituitary gland, like the growth hormone, prolactin, ACTH, thyroid, TSH secretion. There is many hormones, and it take care of not only the pituitary, but also the other gonads are. Whether it is the gonads, it is the adrenal. It is governed by the whether it is the thyroid gland. It is governed by the pituitary hormone. So we call it the master gland because this is the pituitary gland which take care of many other glands in our body. So we call it the master of the pituitary gland.
All right, Dr. Dutta, as we discussed, the pituitary gland controls several other hormone-releasing glands, and damage to the pituitary gland can have major effects on the body. So what can damage the pituitary gland?
Yeah, as Dr. Saab just now said, it's the master endocrine gland. It controls all the glands in the body. So it is present at a very critical, safe location in the center of the brain. There is a bony cage where it sits, and there's brain all around to shield and protect it. But still, unfortunate damage can happen. A fall, a head injury, a banging of the head, a road traffic accidents. So any form of injury to the head, even while playing the ball hits my head hard, that can damage the pituitary gland. And that damage may not be apparent in a few hours or days. Sometimes it may be apparent even 5 to 10 years down the lane. Another important cause is pregnancy, especially in ladies during the time of delivery. If they have lost too much of blood, so that would have led to a state of low blood pressure, and the blood supply to the brain goes off transiently, and that can also damage the pituitary gland. For certain tumors of the head and neck region, we may have to give radiation to the head and neck region, and some of the radiation may unwantedly go to the pituitary gland, and that can also damage the pituitary glands. Similarly, a lot of different anti-cancer therapies are sometimes also known to damage the pituitary glands. And there is a very diverse condition called autoimmune conditions, where our immune system, which typically makes antibodies to kill foreign organisms, by some mistake they start making antibodies against their own body parts. So if my immune system sometimes makes antibodies against my pituitary gland, it will not let it function properly and may lead to its damage.
All right. Dr. Jain, pituitary disorders generally occur when the pituitary gland is either too effective or not active enough. If you could explain this, further to us, what are pituitary disorders?
Pituitary gland can cause the increase in, sometimes there is some increase in the hormone secretion, sometimes there is some decrease in the hormone secretion. As I told, there is many hormones are secreted by the pituitary gland. When there is excess, like prolactin, when there is excess, we call it a prolactinoma. When there is excess of growth hormone, we call it acromegaly. When there is excess of ACTH, we call it Cushing disease. And there can be excess of the TSH. We called it TSH secreting adenoma. And gonadotropic excess is not very common. So these are the common is the excess presentation. Sometimes there is a deficit of them. Like then there is growth hormone deficiency we commonly see in a child having growth hormone deficiency, even as the Dr. Dutta described. When there is some traumatic injury, then there can be a growth hormone deficiency even in the adult. And when there is a ACTH deficiency presenting as a adrenal insufficiency, which is a very emergency situation, and sometimes the TSH secreting problem leading to the central hypothyroidism, which we commonly seen in a postmenopausal, which we commonly seen in a female having a early menopause. Commonly we called it a Sian syndrome. We see there is a TSH deficiency there, and there is a pan-hypopituitarism is there. Not only the TSH is less, there is deficiency of other hormones. That is the gonadotropin is also low. There is deficit of other hormone like as we told, cortisol deficiency there, thyroid deficiency there. But all these, if we properly diagnose, these are the treatable condition. If we properly diagnose them, we can having a medicine for all of them. So there is one part is the excess, one part is the deficit, and we have to properly diagnose it. Once you properly diagnose it, then the treatment is very clear in all the hormonal disorders.
All right, Dr. Dutta, which advanced testing procedures or tests are required for accurately diagnosing a pituitary tumor?
Yeah, so pituitary tumors are pretty rare condition. The good thing about it, they are almost always benign tumors. So they're not cancers. We worried ki if I have a pituitary tumor, is it a brain tumor, right? So not all brain tumors are like the last word. Pituitary tumors are actually pretty harmless tumors. One of the most common pituitary tumors are prolactinomas, where the prolactin hormone secretion increases from the pituitary gland. Now prolactin is a milk forming hormone. It is typically increased only in a breastfeeding mother. But if my prolactin level goes up in the otherwise state, also in a boy or a girl, that can cause milk discharge from the breast, that can cause menstrual irregularities in women. So this is the most common pituitary adenoma. Most reliable test to localize, to measure the size, exact feature of a pituitary adenoma would be do a simple MRI of the pituitary gland. The magnetic resonance imaging of the pituitary gland is the investigation of choice.
All right, well, we'll slip into a short break right now, but don't go anywhere. We have many more questions to ask the doctors. Stay with us. Welcome back. Let's get to the latest on hormone health, and let's return to our doctors. Dr. Jain, can pituitary gland problems be cured? Is it possible to treat pituitary disorders with medication?
Regarding common thing regarding the endocrine, if you properly diagnose the endocrine problem, most are treatable. More than 95% are treatable to the full extent. Depend on the pituitary problem, whether it is the excess or deficit. As I told, if we know there is deficit, whether it is a growth hormone deficit or there is a adrenal problem, secondary adrenal problem through the ACTH deficiency, or there is central hypothyroidism, if we properly diagnose it, or whether it is a hypogonadism, if we properly diagnose it, for the growth hormone, we have a clearly growth hormone that is available and very good treatment option. Same for the gonadotropin deficiency there. HCG, LHFSH, that is by the available by the name of HCG and HMG is easily available, and there is a very good result if you properly use them. And third one, like when there is central thyroid deficiency there, with the TSH is low, if we give the thyroid hormone that is easily available, there is complete treatment of the central hypothyroidism. And when there is central hypothyroidism, we should always rule out the other pituitary disorder. Thing with the pituitary, if there is deficiency of one of the hormone, we should always rule out the deficiency whether the other cells are also damaged. As I told there, as clearly told in the previous thing, there is other hormones is secreted like growth hormone, prolactin, cortisol, ACTH leading to the cortisol secretion, and TSH. If there is deficiency of one of the hormone and other is the LHFSH, which take care of our pubertal part. If there is deficiency of the one of the hormone, we should always look for whether there is deficiency of the other hormones or not. And as I told, when there is deficiency of the ACTH, exogenous steroid can be given, and that is a completely curable. Regarding the excess, when there is excess of these, like when there is excess of prolactin, that is the prolactinoma already described by the Dr. Dutta. Dopamine agonistic is a very good therapy. Probably it is one of the pituitary tumor which didn't need any, most of the time, no any surgical intervention. Dopamine agonistic is easily available, but few of the tumor definitely need surgery. Like when there is excess growth hormone is there, we call it acromegaly. In these cases, we needed surgery. That is the transspinodal surgery we commonly do through the nasal route. And when there is excess of ACTH with leading to the Cushing disease is there, commonly it also needed a surgery that we call the transspinodal surgery. And now if the patient is not, even after the surgery, if they are recurrent, then medical therapy or there is a radiation therapy is also a available option for them. So when there is deficit, we can supplement the hormone from the outside. When there is excess, we can give the treatment that can be a medicine part or surgery or radiation, whatever. Radiation may be gamma knife or external beam radiation. That depends on the patient profile.
All right, Dr. Dutta, what is prolactin hormone and what happens if it's in excess?
Yeah, prolactin is a very fascinating hormone. We all have some amount of prolactin in our body. The normal levels are usually less than 20 nanograms per ml in men and less than 30 nanograms per ml in women. So it's the happiness hormone. It keeps us happy and satisfaction. It gives us, in biologic purposes, it levels goes more than 100 nanograms per ml, usually in the postpartum state and during pregnancy. So this is a major milk forming hormone. So a feeding mother needs this hormone to make milk. So in the non-pregnant state and apart from the postpartum state, these hormone levels are very low in our body. Now rarely we may have a pituitary tumor called prolactinoma, which can lead to very high levels of prolactin, which usually crosses more than 100 nanograms per ml. As Dr. Jain said, this is the most common type of pituitary tumor, and the best part, it is not a cancer. This is a benign tumor and it is fully curable with medications. If you follow up with your endocrinologist, take the medicine regularly, this tumor will totally melt away and disappear. Sometimes the medicine needs to be taken for maybe 2 to 3 years. But prolactinoma is definitely not the commonest cause of rise in prolactin test. Many patients come to us with reports of raised prolactin levels. So we reassure them, see, it is very unlikely you may be having prolactinoma. So what are the common causes of increased levels of prolactin? That would be, I think, medications. Some common medications which we use over the counter, like maybe ranitidine or famotidine, the antacid medications, they are known to increase prolactin. So we need to take a good medical history of such people and find out whether are they taking any culprit medicines which are going to increase prolactin, what we call them as the drug-induced hyperprolactinemia. So once we have ruled out this, prolactinoma then becomes an important cause, and it's a benign tumor, a fully treatable tumor, and the investigation of choice to determine the size of the tumor we already discussed in the previous question, which is the MRI of the pituitary gland.
All right. Now, Dr. Jain, if you could explain to us, what is the relationship between puberty and the pituitary gland?
This is a change in the change in the body texture of the male or female. Normally, in the female, the age of puberty is 8 to 13. Commonly, we call it. And when then the puberty begins before the 8 year in female, we call it a precocious puberty. And if the puberty is delayed by 13 year, we call delayed puberty. Even the menarche, that is the beginning of menses, delayed by more than 15 years. We have to evaluate. And for the female males, we call the age of puberty is 9 to 14 years. And for the same, if it is before the 9 year, we have to evaluate for the precocious puberty. If it is above the 14 year, there is no development of secondary sexual character. We call it a delayed puberty. And from the hypothalamus, there is secretion of the gonadotropin releasing hormone that by the pituitary leading to the secretion of the LHFSH that cause the development of our secondary sexual character. In the male, commonly there is a appearance of the increase in the testicular volume, penile length increases, there is appearance of the axillary and pubic hair. And there is growth spurt is there, change in the voice is there, appearance of the mustache and other features of the secondary sexual character. And in the female, there is a appearance of the breast with the breast appearance is there with the appearance of the axillary and pubic hair followed by the growth spurt. These are the common part of the puberty. If there is early or delayed puberty, definitely there is commonly a problem with the pituitary or with the gonads. Whether it is a primary or secondary gonadal deficiency or excess, we have to evaluate through a proper endocrinologist.
Dr. Dutta, if you could tell us what is the anterior pituitary and what are some of the hormones secreted by the anterior pituitary gland?
Yeah, so the pituitary gland, as you suggested, has two parts. The front part is called the anterior pituitary and the back part is called the posterior pituitary. The anterior pituitary makes 4 or 5 different hormones. Dr. Jain has highlighted some of them. One is the prolactin, we have discussed already. The second hormone is the ACTH hormone, which tells the adrenal gland. Now, this is the gland just sitting above the kidneys. So this makes the stress hormone called cortisol. So when we get angry, when you are afraid of something, our face turns red. So it is the cortisol hormone and other catecholamines which is coming from adrenal gland is driving the response. Our heart rate goes up, we start sweating, we have palpitations. So it's the ACTH from the pituitary gland which drives the cortisol production from the adrenal gland. The third hormone is the growth hormone. The growth hormone is responsible for production of another hormone called IGF-1 from liver, which drives the growth of our bones, and that's how the kids keep on growing till maybe around 15 to 18 years of age. The fourth hormone is the TSH hormone. The TSH hormone tells the thyroid gland, which is sitting under the voice box in front of the neck, to make thyroid hormones like the T3 and the T4 hormones. So unless the pituitary gland makes sufficient TSH, the thyroid gland won't know that they have to make the thyroid hormones. And we know that the thyroid hormones are critical to maintain the metabolism of our body so that we have sufficient energy production in our body. So it's the master regulator. It controls all the different glands of our body. Now, this is about anterior pituitary. Now we have something called the posterior pituitary gland. The posterior pituitary gland has a major role in regulating the fluid homeostasis, how much water should be there in our body. So it secretes a hormone called the ADH, or the antidiuretic hormone, which takes care of the optimal amount of fluids in the body. A typical adult human body has around 5 to 6 liters of body fluids, which is predominantly in the form of blood. So if there is too less amount of fluid in our body, our blood pressure will fall. If there is too much of fluid in the body, we'll bloat up, will appear swollen. So the ADH hormone guides our kidneys and tells our kidneys to how much water to retain or how much water to throw away, how much salt to retain and how much salt to throw away. So that's the beauty of pituitary gland. It's like the big boss. It controls all the other glands and make them work together so that the body as a whole becomes very happy. It remains happy and efficient.
Right. Dr. Jain, if you could tell us what are the symptoms of an abnormal pituitary gland?
Same thing, there is a five hormones already we describing it since last 20 minutes. There is five hormones secreting. Depend on which hormone is excess or deficit. When there is excess of prolactin, commonly in the female it presents as a galactorrhea. Even decreased libido is there. Irregular menses is there. Symptoms of mass lesion, where headache may be there. This headache or vision defect can be part of any pituitary tumor. When the size increases, a small tumor can cause the headache. When there is enlargement, compressing the tumor, compressing the optic nerve can cause even the vision problem. So this is a common with the prolactinoma. Like the growth hormone, excess is there. We know when there is excess, there is acromegaly. We call it acromegaly. And regarding acromegaly, same first is the mass effect, causing the headache, nausea, vomiting, followed by change in the vision. विजन में प्रॉब्लम हो सकती है. इसके अलावा ग्रोथ हार्मोन इज वर्किंग ऑन मेनी अदर पार्ट, लाइक समवन हैविंग ए सेकेंडरी डायबिटिक, joint pain is there, increase in the triglyceride is there, and there is a increased growth of the bone mass. So even the mandible goes out, हाथ बड़े बड़े, there is enlargement of the hands, enlargement of foot, change in the footwear size. If we are wearing the rings, then rings being tight, there is increased wax secretion, there is recurrent ear closing is there. And when there is deficiency of the growth hormone, commonly it is present as in the pediatric age group with a growth hormone deficit, which can be easily rectified by a growth hormone, exogenous growth hormone treatment. And now going to the third one, that is a TSH secreting exogenous tumor. When there is TSH secreting thyroid adenoma, adenoma as a tumor causing the same symptom, depend on their size. And when there is deficiency there of the TSH secreting cells, then hypothyroidism there. We have all the symptoms of hypothyroidism. But here if we do the lab test, there is decrease in the T3 is there, T4 is low, and the TSH can be low and normal. So this is a central thyroid deficiency is there, and all the symptoms of hypothyroidism that we know. Whether it is a dry skin, goiter is absent. This is very clear. When there is primary hypothyroidism, goiter is there, but when there is central hypothyroidism, goiter is absent. And T3, T4 is low, and TSH is also low or normal. And all the features of primary hypothyroid that we see in a hypothyroidism, seen in a patient having a TSH deficiency. And always when there is, I told in the beginning, when there is a central pituitary hormone deficiency, we should always rule out whether the other hormone is also deficit or not. So when there is central hypothyroidism, we should always rule out the adrenal deficiency, that is the ACTH deficiency, because this is the emergency situation and can present as a hypotension, low BP can present in the emergency department. Patient with any illness, any sickness, patient can present to the emergency department. And when there is deficit of the gonadotropin, patient can present with a delayed puberty, what we call it the delayed puberty or absent one. There can be if this gonadotropin deficiency occur after some in the adulthood, after some probably some accident or scenic venom injury. So in the follow-up can present with the gonadotropin deficiency with low libido, features of metabolic syndrome, with poor mustache growth and beard growth. This can be secondary presentation also of the gonadotropin deficiency.
All right. Well, thank you so much, doctors. We're completely out of time. Sorry to interrupt you there. We'll have to wrap the show. But thank you, doctors, for joining us, and thank you all for watching at home.